Bhavna Gordhan, and I'm a principal medical scientist here at the NHLS. And what we do here, so we're affiliated to the NRF DST Center of Excellence for Biomedical TB Research. And our work is predominantly to try and find new drug targets for TB. And more recently, we've moved into the clinical space where we're trying to improve on diagnostics and provide better diagnostics for TB and more recently for COVID as well. TB is an infectious disease. It is deadly, so if it's not treated, it can cause death. So basically when a person, it's transmitted through aerosol, so if someone coughs up TB, if you're in the vicinity or someone standing nearby, they will be able to inhale those droplets, and those droplets then seed into the lung, into the alveolar spaces in the lung, and start causing respiratory disease. And this usually starts off, the symptoms are generally fever, night sweats, loss of weight, loss of appetite, and if not treated, the person can literally waste away and die. The common symptoms are fever, night sweats, loss of appetite, loss of weight, coughing, and if the disease progresses without treatment, the coughing will get to a level where it starts affecting the lungs so badly that the person will actually cough up blood. And the way TB is treated currently is by drugs. So we have 4 drugs that are first-line drugs that are able to treat susceptible TB. But we also have forms of resistant TB that requires more toxic or more expensive drugs and also longer treatment. So for drug-sensitive TB, the 4 drugs are taken for 6 months. So it's quite a long-term treatment plan, and compliance is very essential. Otherwise, the patient will develop resistance against those drugs, and then it just becomes more and more difficult. Like COVID, TB is a bacteria, so it has to, it needs antibiotics to kill the bacteria off. Otherwise, it's not going to just disappear after its cycle. It's just going to multiply and make the person more sick. But while they're on treatment, it's a good idea that they do isolate, but you cannot say that they're going to get better. They do need treatment, and treatment is very effective if taken correctly and on time. So they would then start decreasing the bacterial load within the first week to, we've done studies here where we see in the first 3 to 7 days, the numbers decrease and they become less infectious. So it's very important that they do take all the medication on time and as indicated. I would say drug-sensitive, for drug-sensitive TB, the drugs are available. It does become more and more challenging and complicated for people to access the drugs for drug-resistant TB. And sometimes also, those drugs are sort of individual, so they may not be widely available at all the clinics. And I think with the lockdown, this has become a bit of a problem because people weren't able to get to their clinics. As I mentioned earlier, it's a 6-month treatment plan, and people usually go monthly to go get their medication. So obviously with lockdown came all those challenges where people weren't able to go to their respective clinics, or perhaps they were afraid that they're going to contract COVID. So those have been some of the challenges that have led to sort of breakdown of the TB treatment programs and people becoming more sick and more and less diagnosed. Our numbers are increasing because we actually don't have a handle on what is going on in this period between. We have numbers up to 2019. But what's happened in 2020 with COVID, we'll only know in this year's report. So this is why it's very difficult to actually see but what's happened to the actual numbers. But definitely we have declined in our diagnosis, and this is numbers that we're going to find more and more people are going to be sick in a coming year or so. And if you think about the symptoms again, so COVID and TB do share some of those symptoms. So for example, if a person is coughing, maybe because of stigma, they're not going to go to the clinic. And both diseases do have stigma, so they might not go. And the second thing also that's happened, I think, is with lockdown, we are more in close contact, and TB is an infectious disease. So if you're going to be in a household where there's someone that's sick and the other people are in close contact more than when they were before lockdown, the chances of them getting sick are far higher than what it was. So again, the numbers will be increasing because the household contacts are going to be also getting sick. So for COVID, I think we're standing at about 50,000 deaths thus far. TB for 2019 has been about 58,000 deaths in South Africa, and this is expected to rise to close to even 200,000 in the coming year or two. And this is simply because we are underdiagnosing, and the lockdown and COVID has now led to all the reallocation of resources in terms of human resources, financial resources in managing and dealing with COVID. So TB has almost become a neglected disease, so to speak. And this is going to be, we're only going to see this effect in another 2 to 3 years, where we're going to see these numbers just increasing. And the other problem we're going to face is that all that we have gained thus far in controlling TB has been undone. It's all come apart now, several of the programs, etc. And according to the Stop TB Partnership, their sort of prediction is that even if we reintroduce these programs, we are not going to still get up there. So we need new interventions, new ways of dealing with this disease. So it's almost like we've taken a step back now in trying to control this disease, which has been with us for so many decades. And yet, with all the efforts that we've put in, with COVID, on our doorstep, it has just created this whole ripple effect